For my video, I decided to do the St. Lawrence Psychiatric Center, which is the agency that I currently work at. There is no photography allowed on the campus of the facility. All images seen here have been uploaded to the internet with assumed permission by the image's publisher. The St. Lawrence Psychiatric Center opened its doors December 9th, 1890, and was referred to as the St. Lawrence Asylum for the Insane. Later, the name was changed to the St. Lawrence State Hospital, and finally the St. Lawrence Psychiatric Center. Originally, the facility was 950 acres. The facility is located on the banks of the St. Lawrence River in Ogdensburg, New York. The mission of the agency, as stated by the New York State Office of Mental Health, is as follows. The New York State Office of Mental Health promotes the mental health and well-being of all New Yorkers. Our mission is to facilitate recovery for young to older adults receiving treatment for serious mental illness, to support children and families in their social and emotional development, and early identification and treatment of serious emotional disturbances, and to improve the capacity of communities across New York to achieve these goals. There are 3 residential programs located on the facility grounds. Adult Services, which is located in the Trinity Building, a Sex Offender Treatment Program, which is located in the Bridgeview Building, and Children and Youth Services. All residential programs offer a comprehensive range of services, including individual and group counseling, diagnostic evaluation, psychological testing, crisis intervention, psychopharmacology, medical evaluation, vocational assessment, education, socialization, task and skill training, physical therapy, structured learning therapy, occupational therapy, and recreational therapy. In addition, weight rooms, a recipient resource center, a snack bar, and community programs are available. Outpatient clinics offering diagnostic assessment, individual and group treatment, medication therapy, case management, and crisis services are available to both adults and children and youth in major population centers within St. Lawrence County. Day treatment programs for children and youth, in collaboration with BOCES, are also offered to St. Lawrence County residents and to adjacent Jefferson County children and youth. Outpatient residential programs are also operated by the Psychiatric Center through the On-Grounds Community Residence and the Family Care Program, a network of certified private homes located in St. Lawrence, Jefferson, and Clinton counties. Self-help and advocacy services are provided through a local consumer-run organization, Step by Step. A Bridger program provides the link to Step by Step for adult recipients. In addition to its inpatient and outpatient programs, SLPC has a new, state-of-the-art sex offender treatment program that currently is a 90-bed capacity facility with plans to expand. The SRTP's mission is to balance individual treatment needs and community safety. The treatment model promotes positive changes for individuals participating in the program in an effort to reduce the risk of future sexual reoffense. The St. Lawrence Psychiatric Center is a large facility which has many different functions and serves a wide variety of clients. Its catchment area serves much of the northern part of the state. The history of the facility is fascinating to most people. There was once over 3,000 patients who resided at the facility. Present-day census numbers are approximately 200 patients, including the SOTP. St. Lawrence pioneered an occupational therapy program in 1908, which was imitated by hospitals throughout the country. There was a farm on the campus which made the facility almost totally self-sufficient until the 1960s, when labor law restricted patient labor. When the facility opened its doors in 1890, there was only 23 schools of nursing in the entire country. Rather than recruit nurses, the director of the facility decided it would be easier to train his own. There was also no textbooks available at the time, so the director wrote his own, which became the standard text in all Department of Mental Hygiene nursing schools. I can't talk about the history of the facility without mentioning the abandonment of all the old buildings. After the big deinstitutionalization movement of the mentally ill in the early 70s, the state decided to downsize most of its programs and send many of its patients out into the community with little to no available services. The result was that many buildings would no longer be needed to house patients. Rather than pay the maintenance to keep up on the buildings, the state decided to turn off the power, the heat, and shut the doors. It is truly a shame, as these buildings are architectural marvels. St. Lawrence is just one of very many facilities that have beautiful buildings that just sit there rotting on the lawn. Recently, the New York State government developed a new plan that would create regional centers of excellence throughout the state, replacing the current individual scattered facilities. The main reason of the plan was that it would be easier to control costs and provide patient care by centralizing everything. St. Lawrence was slated for closure. The community rallied together for 7 months to try and change the governor's plan. The support was overwhelming, and the reasoning was sound. The geography alone made no children's services available for up to 120 miles away. While the Regional Centers of Excellence plan remains, rather than closing, St. Lawrence will now be one of those centers of excellence.